This content is not designed for use as a medical reference to diagnose, treat, or prevent medical illnesses or trauma. If you have questions about the diagnosis, treatment, or prevention of a medical condition or illness, please consult your personal physician.
Welcome back, everyone. In our last lecture, we took a look at autism spectrum disorders, the symptoms that characterize them, how they're diagnosed, why Asperger's syndrome is no longer considered to be a standalone diagnosis, incidence rates of autism and common comorbid diagnoses, and presumed causes. Today, we're going to continue our discussion of autism by examining research on brain pathology, savant abilities, and treatment options. We'll start with brain pathology. Because of the heterogeneous nature of autism, it should come as no surprise that the research on brain pathology is somewhat contradictory. So for this lecture, I'd like to focus on those research findings that have the most evidence to support them and that have been replicated by different laboratories. In early childhood, individuals with autism have increased brain volumes, so their overall brain size is larger than individuals without autism. This accelerated rate of growth decreases over time, however, such that by late childhood and early adolescence, the overall brain volume of someone with autism and someone without it is similar. This finding persists even after controlling for variables such as height, gender, the presence of seizures, and other medical disorders. There also appear to be deficiencies in the organizational structure of the cerebral cortex in autism, which directly affects its functional capabilities. The neuropathological features that have been identified include neuroinflammatory and cellular changes, as well as regional differences in the size, morphology, number, density, and distribution of neurons and glial cells. These features can result in widespread deficits across the brain. Specific brain areas that have received the most attention include the cerebellum, hippocampus, amygdala, and frontal cortex. Let's take a brief look at each of these areas, starting with the cerebellum. As you may recall from Lecture 1, the cerebellum plays a role in a number of processes, including fine motor control, cognitive processes, and emotion. Several studies support cerebellar abnormalities in autism, although the type of abnormality identified varies across studies. This is due in part to the heterogeneity of the disorder, which it is also influenced by which patients are selected for various research studies. One consistent finding is that there is a substantial decrease in the size and number of Purkinje cells among those with autism, primarily in the posterolateral neocerebellar and archicerebellar cortices. Because Purkinje neurons are the sole output of the cerebellum, it stands to reason that if they are deficient in some way, their output will also be deficient, which will impact behavior. Another brain area, the hippocampus in the temporal lobe, is part of the limbic system that plays a role in memory and emotions. Abnormalities noted in the hippocampus associated with autism include increased cell packing density, so increased numbers of neurons per unit volume, and decreased complexity of dendrites. Dendrites are the segments of a neuron that receive messages being sent from neighboring neurons. Decreased complexity of these dendrites would directly affect the communication both within and between areas of the brain. The amygdala, which is also part of the limbic system, has been implicated in autism as well. Research suggests the existence of aberrant growth patterns in the amygdala with early enlargement of the area, leading ultimately to a reduction in the overall number of neurons present. This malfunction of the amygdala could result in impairments in social interactions, emotional memory, and facial recognition in autism. The final brain area I want to mention is the frontal cortex. Recall that this brain area is associated with executive functions, including higher order cognitive processes such as decision-making, personality, working memory, social behavior, emotions, and learning and communication. Autism research suggests the existence of abnormal cortical growth patterns, abnormalities in cortical thickness, and disorganization of neurons across the various cortical layers and their connections to other brain regions. As you can see, aspects of autism can be linked to many different areas of the brain. Additional areas that researchers have found may contribute to the disorder include the deep cerebellar nuclei, the cingulate cortex and other parts of the limbic system, and brainstem nuclei like the inferior olivary complex, to name just a few. Though we've made a lot of progress, we obviously still have a lot to learn about the autistic brain. Turning to savant abilities, these are among the most mysterious and fascinating features of autism. The most well-known portrayal of these abilities appears in the 1988 movie Rain Man, in which Dustin Hoffman plays the role of an autistic character named Raymond Babbitt. The primary inspiration for Hoffman's character was actually a man named Kim Peek, who had a variety of unique abilities. Having memorized thousands of books, Kim had vast amounts of information at his disposal. For example, he could name all the U.S. area codes and major city zip codes. He could also memorize maps and could explain to you precisely the steps needed to travel from one U.S. city to another. And he could even tell you how to get around various cities, street by street. Kim also exhibited advanced musical talent, being able to play musical compositions he had memorized on the piano. Then there's Stephen Wiltshire, born in 1974, who was diagnosed with autism and also has savant abilities. You may have heard of him. He draws lifelike depictions of cities, skylines, and urban scenes from memory. His craftsmanship and spatial and memory skills are phenomenal. For example, in 2001, he appeared in a BBC documentary called Fragments of Genius. For the program, he flew over London on a helicopter and then completed a detailed and perfectly scaled aerial drawing of a 4-square-mile area he had observed, including 12 historic landmarks and 200 other structures. And he did it in 3 hours. Or consider Leslie Lemke, who was born in 1952, has autism, is blind, and is an exceptional piano player. In fact, he can remember a piece of any length and play it back flawlessly, even after only hearing it once. Incredible. How in the world can people do these things? Well, before we delve more deeply into this topic, let me begin by saying that it's a controversial one, with different researchers speculating about how to define, measure, and explain these abilities. In 2015, André Anne Meyer and colleagues argued that reports of these abilities vary widely depending on the criteria used to measure them. They actually divided savant abilities into 2 distinct categories: strengths and talents. A strength is when a person, for example, performs in the average range on an IQ test, but when tested on one or more abilities within that IQ test, for example, subtests that measure visuospatial abilities, they perform in the exceptional range. In contrast, a talent is when an individual excels in a particular ability or skill, like playing the piano or multiplying numbers. Talents are typically noted by the individual's family members rather than by being measured by standardized tests. When most people think of savant abilities or skills, they think of these talents, which generally occur in 5 different categories. Music, often piano playing with individuals exhibiting perfect pitch. Art, so drawing, painting, or sculpting something previously seen and replicating it from memory. Calendar calculating, for the ability to correctly state the day of the week upon which any given day falls. So, for example, knowing what day of the week it was on February 9th, 1934. Mathematics, so fast calculating and the ability to compute prime numbers. And mechanical or spatial skills, such as measuring distances precisely without using any instruments, constructing accurate complex models, or mastering map making and direction finding. In a 2009 review, Daryl Treffert argued that all of these skills rely on having an exceptional memory, which is why memory itself is not listed as a separate category. He noted, however, that other researchers do list memory as a separate skill, usually as memory for dates, places, routes, or facts. Note that as a group, these savant skills are described as being primarily imitative in nature rather than creative. So, for example, when someone plays a song on the piano that they've only heard once, or when someone memorizes an entire book, they are not composing or writing the underlying work, but simply repeating it. In 2009, Patricia Howland and colleagues conducted the first study to explore the presence of both talents and strengths in people with autism. They studied a group of 137 individuals and found that 28.5% of participants had a talent, 17% had a strength, and 11.6% had both. Approximately 6 years later, in 2015, Mayer and colleagues conducted their study on 254 individuals diagnosed with autism. But unlike Howland and colleagues, who measured strengths using Wechsler intelligence tests, Mayer and colleagues measured strengths through a visual spatial task and a pitch discrimination task. They found that 62.6% of participants had a talent, 57.5% had a strength, and 7.2% had both. One question concerns why these percentages of talents and strengths are so different between these two studies. For example, a prevalence rate of 28.5% for talents in the Howland study compared to 62.6% in the Mayer study. There are a couple of reasons why one might see these discrepancies. First, the Mayer study counted strengths and talents that were current, as well as ones that no longer existed, but were present at some point in the past, while the Howland study only included current talents and strengths. And second, the participants in the two studies were different. Those in the Howland study were diagnosed according to an older definition of autism and displayed more atypical characteristics, whereas those in the Mayer study were diagnosed using the most current definition of autism. These are things to keep in mind as you hear varying percentages of savant abilities in the autistic population, how strengths and talents are measured and defined, and participant characteristics like gender, age, diagnostic criteria used, and so on, can significantly impact the prevalence rates reported. The Mayer and Howland studies also use different types of assessments to measure both skills and talents, which could easily contribute to the discrepant findings. So how does one explain these savant abilities in terms of brain functioning? Well, one theory that keeps popping up in the literature goes something like this. The left hemisphere in our brain completes its development later than the right hemisphere does. Because of this, it is subjected to adverse prenatal influences for a longer period of time. Moreover, in males, who are more likely to show savant abilities than females, circulating testosterone can slow growth and compromise neural function, directly affecting the left hemisphere. This can then cause actual enlargement and a shift in dominance, such that skills associated with the right hemisphere become favored. When you sum it all up, this chain of events basically means that compensatory growth in the right hemisphere occurs because of impaired development in the left hemisphere. The left hemisphere is primarily associated with verbal skills, logical reasoning, and local detailed processing, whereas the right hemisphere is primarily associated with spatial reasoning, nonlinear thinking, and global holistic processing. Because of this developmental issue, most savant abilities emerge early in development among those with autism. However, there are some individuals without autism who develop similar savant abilities after suffering from a brain injury, stroke, or a disease like dementia. The theory of left brain damage and ensuing right brain compensation is in agreement with this research. Consider, for example, a 2018 study that Bruce Miller and colleagues conducted on frontotemporal dementia patients. As the name suggests, frontotemporal dementia results from damage to the frontal and temporal lobes of the brain. The researchers found that patients with degeneration in very specific regions of the frontal lobe and in anterior sections of the temporal lobes on the left side of the brain show a sudden expressed interest and skill in art or music as their dementia progresses. In a 2003 study, Alan Snyder and colleagues showed that you can actually increase savant-like skills like proofreading abilities and artistic competency in people by using low-frequency magnetic pulses to suppress the left frontal and temporal lobes. When this was done to undergraduate volunteers, the aforementioned skills soon appeared. Both of these research findings lend support to the idea that damage to the brain's left hemisphere and associated compensation in the right hemisphere might contribute to the development of exceptional savant skills. So, does this mean we all have latent savant skills that we cannot access? Snyder and colleagues argue that we do. Think of it this way. We know that the skills demonstrated by savants are imitative and not creative, since they involve the processing and memorization of details. As I mentioned earlier, information related to details is primarily controlled by the left hemisphere in the brain. Meanwhile, information about how these details combine to form a whole picture or concept is primarily controlled by the right hemisphere. So we basically have these two networks in the brain that are primarily concerned with either processing the details of a scene or processing the global meaning of a scene. Here's an example. You walk into a building and you see details like shopping carts, apples, meat, cheese, milk, and so on. This is because your left hemisphere focuses on the individual items you are seeing. The right hemisphere, on the other hand, tries to make sense of everything it is seeing and comes to the conclusion that you are, in fact, in a grocery store. And this is where people go to buy food and other items. In the non-autistic brain, the overarching theme or label of grocery store and what it is for suppresses the ability to, say, repeat back every item in order that appears in one aisle of the store. We have no need to be consciously aware of such minute details. It serves no purpose. Seeing things as a meaningful whole, however, does serve a purpose. It accelerates our decision-making ability, especially when confronted with only partial information. And it helps us to learn things. If we couldn't group things into meaningful chunks of information, our brains would be easily overwhelmed. Now consider what would happen if we changed how these networks worked. Let's say you were somehow able to suppress the global holistic network, thus allowing you privileged access to the network that contains raw, less processed, detailed sensory information. This is exactly what Snyder and colleagues think is happening in individuals with autism who show savant skills. Because of the brain deficits formed during development, so the atypical hemispheric imbalance, the global holistic network becomes suppressed in some individuals, allowing them to become more aware of the details that comprise something. It's not that these individuals are actively learning these details. It's that they now have conscious access to this information that resides in all of our brains, and they are able to draw or verbalize it flawlessly. Fascinating stuff. Let's now turn to treatments. Let me start off by saying that the best treatments for autism are behavioral ones. Although there have been various studies on treatments associated with autism, no one practice or intervention is equally effective or appropriate for all children with the condition. I'm sure this comes as no surprise to you, given what you now know about the heterogeneity of this disorder. So instead of trying to say program X is better than program Y, researchers have identified essential components of effective programs that seem to work with individuals with autism. For example, the following 6 essential themes should be included in any effective individualized educational program, or IEP, for students with autism. 1. Individual supports and services for students and families. Some students may need minimal or moderate modifications to their general education curriculum, whereas others may need more major modifications. 2. Systematic instruction. Teachers need to figure out what meaningful skills need to be taught to the individual, plan out when and how to teach these skills, determine how to assess the effectiveness of their teaching method, and then modify their teaching method based on data they collect regarding what works and what doesn't. 3. Comprehensible and/or structured environments. A comprehensible environment is one designed to elicit, facilitate, enhance, and support the acquisition of specific skills that are lacking. A structured environment is one in which the curriculum is clear to both the students and the teachers. 4. Specialized curriculum content. The curriculum should be designed based on the individualized assessment of skills in each individual. 5. A functional approach to problem behaviors. Teachers and family members should not solely focus on decreasing or eliminating problem behaviors, but rather attempt to replace such behaviors with appropriate alternative behaviors. 6. Family involvement. Schools should include parents as active partners in their child's educational plan. What about medication for autism? So far, only 2 drugs have been approved by the U.S. Food and Drug Administration for the treatment of some symptoms associated with autism. These drugs are risperidone and aripiprazole. Risperidone, an adult antipsychotic, was approved in 2006 for the treatment of symptoms like irritability, aggression, deliberate self-injury, and tantrums. It blocks the brain's receptors for dopamine and serotonin and can be given to children and adolescents with autism. The drug typically leads to improvements in stereotypic behaviors and hyperactivity, but it can also have a variety of side effects and is most effective for short-term use. The other drug, aripiprazole, was approved in 2009 and is an atypical antipsychotic. It is designed to treat irritability associated with autism in children and adolescents, but it is also influenced by which patients are selected for various research studies. It's characterized as a dopamine system stabilizer in the brain. As you can see, drug therapy is very limited and only beneficial for certain individuals, symptoms, and time periods. The most effective treatments, as we've already discussed, tend to be behavioral in nature. One point that I repeatedly try to make across all of my lectures is that when you are searching for treatments for any disorder, including autism, you should make sure it has scientific evidence to support it. There's a lot of crap out there, and when people start to feel overwhelmed and hopeless about finding an effective treatment, they are more inclined to try anything, whether or not it is scientific. In some cases, these unscientific alternative treatments can be expensive, require a great deal of time and energy, and may be dangerous. Some research suggests that parents of an autistic child are more likely to rely on word-of-mouth referrals for treatment than scientific sources of information. With the advent of the internet, all kinds of alternative treatment testimonials can be found, making sensationalist claims without any scientific evidence to back them up. For autism, some of the more common alternative treatments that exist include things like special diets, like gluten and casein-free ones, vitamin therapy, animal therapy, like horseback riding, chelation therapy, music therapy, and secretin, to name just a few. Let's briefly take a look at two of these alternative treatments, a gluten and casein-free diet and secretin. The notion that a gluten-free, casein-free diet can be used to treat autism is primarily based off of two hypotheses. One is that the abnormal metabolism of gluten and casein in individuals with autism may result in excessive opioid activity in the central nervous system, thereby altering its function. The second hypothesis is that the abnormal function of gut bacteria in autism leads to the increased passage of gluten, casein, and their metabolites into the bloodstream and the central nervous system, a process referred to as a leaky gut. When combined with a metabolic defect, some argue that this leaky gut may contribute to the development of autistic symptoms. So does science support this? Two articles have been published reviewing the scientific studies that investigated this issue, one in 2010 and one in 2018. They both came to the same conclusion. There is little evidence that following a gluten-free, casein-free diet is beneficial for the management of autistic symptoms in children and adolescents. In sum, this claim has no scientific support. What about secretin? Secretin is a hormone that naturally aids with digestion. Secretin therapy involves giving either natural or synthetic secretin through injection to individuals with autism. The claim is that this treatment helps to reduce problematic behavioral characteristics. This idea is based on a non-blinded, uncontrolled 1998 study by Keith Horvath and colleagues on the effects of secretin on 3 children with autism. These 3 children received synthetic intravenous secretin during a routine endoscopy examination for repeated gastrointestinal problems. After this infusion, improvements in social, cognitive, and communication were noted. This result then led the public to seek out secretin as an alternative treatment for autism. In 2011, a review article was published examining the effectiveness of secretin in treating autism. The authors searched the literature for quality studies that met certain criteria, were published between 2000 and 2010, and were conducted on children between the ages of 2 and 12. They found a total of 7 randomized control studies that met their criteria for inclusion. What do you think those 7 studies found? You already know what I'm going to say, don't you? Not a single study found significant improvements in language, cognition, or other autistic symptoms when comparing the secretin group to the placebo group. Not a single one. There is no scientific evidence to support the use of secretin to treat symptoms of autism. So there you have it. Always look for the scientific support for any claims regarding treatments for autism. Thanks for joining me today. Hopefully, you now have a better understanding of the brain pathology associated with autism, savant skills, and treatment options. In our next lecture, we'll address another developmental disorder, ADHD, or Attention Deficit Hyperactivity Disorder. See you soon.